Welcome back. Health insurers are being roiled by uncertainty in the marketplace. Insurers in Connecticut could be joining the long list of states facing Obamacare premium increases this year. They are proposing double-digit increases for premium plans next year, ranging from 19 to 52%. Joining us right now to talk about it is the chairman and CEO of Henry Schein, Stan Bergman. Stan, it's good to see you. Thanks so much for joining us.
Good to see you, Maria.
So, Connecticut insurers are saying that this proposal is in response to rising medical and drug costs. These are huge increases.
Well, Maria, we need to control our health care spend in this country. And the best way to focus on that is to advance wellness and prevention. How we pay for health care, we'll leave that up to the political world to decide. At the end of the day, we need to find a way to keep people out of the hospitals. And there are only two ways to do it: wellness and prevention, and to move procedures from the hospital to the alternate care site.
How do you do it? How do you make sure people understand wellness and prevention? You're right.
The bottom line is people need to understand that over 70% of healthcare spend relates to the non-communicable diseases. That is cancer, that is diabetes, pulmonary, cardiac, and of course two key non-communicable diseases are oral care and mental care. And all of these together, we need to make sure that the public understands that we need to focus on this.
What causes those? Bad eating and smoking?
Yes.
There you go. So it's behavior.
Lack of exercise.
Lack of exercise.
But that is changing human behavior. And it requires self-determination and personal responsibility.
Yes.
And nobody in government will ever admit that.
That may be true, Dagan, but, you know, Stan, I think the most important thing is that people can make lifestyle changes. We have done it with smoking, with seatbelts. We've done it with littering.
By the way, we
just
had Dr. Venter, Craig Venter, on yesterday on this program. He's the guy, one of the people who mapped the genome. He believes we're living into our second century.
Yes, I think the number of years people are going to live is going to grow. I think the fastest growing cohorts in the world today is the over 80s.
That's right.
Having said that, the over 80s are having mental challenges, and we need to deal with these things. And the best way to do it, and I don't want to put the responsibility on you, is through the media. You need to help educate the public. We need to educate governors. And I know, Mike, that when you were a governor, you advanced oral care as a key component of your healthcare strategy. We need that throughout the country.
Governor, I just want to follow up on something you said. In terms of cutting back smoking, that was government directed.
Correct.
The governments made it impossible to smoke in public, and they made cigarettes so expensive that people simply stopped smoking.
That was brought to the attention of the public during President Bush's presidency by, at that time, Secretary of Health Lou Sullivan, who went out to the public, got the president's enthusiastic support, and went out and told American people to stop smoking.
So what should we do? Tell them to stop eating cheeseburgers?
Absolutely.
Come on.
So you're a Mike Bloomberg guy. Mike Bloomberg
I know that's your point, right? So what are we supposed to do? Take away their sodas?
Absolutely. We need to go to the schools and teach the kids.
With no justification. I mean, what do you tell the burger makers?
Oh,
what do you tell the soda makers?
I don't want to go attack any one part of the food equation.
No, but we know what causes heart disease.
Well, we've got to get out. We attacked the tobacco people at one time, and we went out and said tobacco is bad for you.
But I would argue that governments is the last role. The first role is media awareness and training and education.
Yes.
Government codifies a new behavior after it's become a new behavior. They can't force it, Dagan. It's after the cultural atmosphere has changed that the government acts.
No, it was the government labeling of cigarette packs, basically saying if you smoke, you die. That was the
government went out. The Secretary of Health went out and spoke about the importance of reducing or eliminating cigarettes. Exactly how it was implemented is not as important.
What's the next thing we have to get rid of?
We have to make sure that we exercise, smoke less, and eat better.
Yeah.
And you know who said that? Tommy Thompson went out and said that when he was Secretary of Health.
Well, there's truth. I mean, you're right. And people don't even understand what's bad for them. They don't understand how bad certain things are, like whether it be sugar or... You just posted earnings. Henry Schein just posted earnings moments ago. Earnings, revenue coming in above expectations. You affirmed your full-year guidance. So characterize the quarter and how this all fits into the growth story of Henry Schein.
At the end of the day, Maria, the Henry Schein story is about advancing wellness. We have about 1 million dentists, physicians, and veterinarians that do business with us. Actually, it's 1 million customers, 1.5 million practitioners who are all involved in wellness and prevention, taking care of people preventing them from getting sick, and if they get sick, taking care of them outside of the hospital. This is what's driving Henry Schein's growth, and it's driven our growth for over 21 years since we went public.
All right, we will leave it there. Great to have you on the show today, Stan. You made a lot of important points. Thank you very much.
Thank you.
Stan Bergman joining us there.